Ask the Doctor by GPDQ. Expert medical advice for you, your family and your colleagues.
Hi, this is Lucas, and we have our clinical director on with us today, Dr. Kathrina. Hello.
Hi, Lucas.
Hi. So we're hoping to be getting out of the pandemic, and there's obviously been quite a lot of information about mental health and how we have potentially suffered throughout. So I thought it would be a good time for us to touch on that as well. So firstly, what is good mental health?
Perfect. Thanks, Lucas. So yes, I agree. We should be talking about mental health as we come out of the pandemic, trying to improve our mental health going forward, because there has been a rise in mental health during the pandemic. So firstly, what is good mental health? And I think to address that question, Lucas, we should actually look first at what the definition of health is and how we define good health as a starting point. So the WHO, the World Health Organization, they put the definition of health as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. And so this definition actually suggests that good mental health should be thought of not in isolation, but rather in a close interaction with good social well-being and physical health. And we can see that it's understandable through the pandemic that when we've had a rise, that we have had a rise in poor mental health, because everyone has had uncertainty or disruption to their social well-being and physical health.
Yeah, absolutely. So would you be able to sort of describe and give us examples of mental health conditions?
Yeah, of course. So mental health is quite a broad kind of term. So in specific, the mental health conditions, so you've got mood disorders, for example, depression and bipolar, and we have seen a rise in depression, for example, over the pandemic. We've got anxiety disorders, again, we've seen a rise there, personality disorders, psychotic disorders, eating disorders, trauma-related disorders such as PTSD, and in some ways, this pandemic has been, traumatic to us. So we've seen a rise in PTSD related to the pandemic as well. Substance disorders is another category.
Yeah, so there's obviously a bit of a stigma around that, but what are the good ways of thinking about mental health?
Great. So I think that we should approach mental health and kind of start thinking about it as a concept that most people experience fluctuating mental health. So occasionally feeling down or experiencing symptoms of low mood or anxiety, for instance, for a short period doesn't mean that you have depression or poor mental health. And it's completely normal and natural to have fluctuating mental health and emotions which are reflective of the situation or event that you're exposed to. Secondly, I think, Lucas, it's helpful to consider that mental health is, for example, on a scale. So if you think, for example, on the one side of the scale, you've got good mental health, and as the scale moves, for example, over, you've got your mental health that perhaps progresses into poor mental health, which kind of maybe starts as mild and then moderate and then severe. So people may be on different parts of that scale at different parts in their life. So, for example, when doctors assess depression, they put the depression on a scale according to the symptoms that you encounter and how often you encounter those symptoms. And we can help treat a person depending on where they are on that scale. So when you're thinking about mental health and trying to be proactive, there's different approaches to different people depending on where they are on the scale.
Yeah, totally. So, I mean, I'm positive there is some sort of a way of looking after our mental health. So would you be able to sort of give us some general tips out there that are out there?
Absolutely. First of all, I think that the most useful thing to do is just to go right back to basics and try and make sure you're getting your basics correct. And what I mean by that, so for example, sleep is hugely important. Good sleep hygiene. So to get that, you might consider going to bed and waking up at the same time every day. You might consider trying to avoid your electronic devices before you go to sleep, sleeping in a dark room, for example, reducing the alcohol that you consume to get a better night's sleep. And obviously there's more in-depth information. And I think we've done a video on this as well, to good sleep hygiene. So just to really put effort into getting good sleep. Other ways of going back to basics, for example, eating healthily, trying to avoid junk foods, not eating, for example, too late at night so that you don't sleep. Exercising. but exercising in a way that is kind. So if you hate running, for example, don't say that you're going to run every day, which I fall into that category. I don't like running, but I like tennis. So tennis is a great exercise. And for me, that's kind exercise. It's something I enjoy, and it's also a hobby. So I wouldn't say I'm going to exercise and run 5K every day, because I think I would become depressed.
Yeah, no, same.
Exactly. Drinking sensibly, that we touched on. Caring for others is also a really good way to improve your own mental health, because you're investing in the relationships that count, and also caring for others can make you feel better yourself. Communicating, telling friends and family, which is good for their mental health and good for yours, and of course seeking help when you feel that you need it.
Yeah, sure. I mean, yeah, that kind of just reminded me that very often, if for the care for others, is giving is more than receiving, and it's always been the case. Yeah, totally.
Absolutely.
And so, I mean, there is obviously a stage of where we don't know what to do, and then we probably should be looking for some sort of help. So, when do you think we should start looking at elsewhere than just those little tips that were mentioned?
Yeah, so I think that in general, seeking help for mental health, really you should do it early, and seeking help early is not a bad thing at all. So sometimes what can happen with poor mental health or declining mental health is that having low mood, for example, can actually trigger behaviors that worsens your mood, and it can become a cycle that is very difficult to get out of. So what I mean by that is, if you consider somebody who's got low mood, what they might end up doing is not wanting to socialize with their family or their friends. They might drink more alcohol, they might exercise less. And so these characteristics or these behaviors might make the underlying low mood worse, making it in turn more difficult to seek help and more difficult to exit this cycle. So seeking help early can help break the cycle and get you out of it in a quicker manner. So this is a kind of one way to seek help early, or one reason. Alternatively, or other things that you should look for, is if your low mood and symptoms have lasted perhaps more than 2 weeks, or if you have thoughts of harming yourself or concerned about your well-being in general. But basically, if you see your doctor for poor mental health, they will always be very happy to try and help you.
Yeah, definitely. Talking. Well, lots of really valuable insights there. So thank you so much.
Thanks, Lucas.
Thank you all for listening, and do remember to tell your friends. Remember this week to put yourself and your health first.